All right.
Says you've disabled my video.
Dang it. How did I do that? How did we
I
do
don't
this?
ask questions anymore.
Change panelist appearance. No, that's not what I want. Okay. How does this? We had it right. Okay. I've disabled your video. Let me see what this does. Allow video. Not pinch. How did we do that before? Okay. So what I'll do, we'll go back in there. Okay, we'll do this again. Oh, I know how I did that. Okay, now I think you can do it now.
Yep.
Okay. Sweet.
Cool.
Yeah, I told you this summer stuff would get you.
Oh my gosh.
It's pretty quick. It's for those that are watching currently, when Michigan gets nice, it's hard to not you lose the weekend for sure. Like really fast. So
I feel like if it wasn't
I have senior, we both have two different seniors. That was busy as busy could get too. So
yeah.
that was awesome. But so tonight we're going to talk about the wrist. Very
Oh,
cool.
okay.
Yes. And so I'm kind of excited about it. It seems boring at first, but it's kind of important. It's kind of one of them important joints that a lot of times you won't hear people talk about very often until they're having major problems with them. So that's what we're going to talk about tonight. My first is the cool stuff I found, just this week's like in the news, basically. So we're going to talk about, let's do the first one. So there's this new obesity pill, obesity injection as well. That is like hundreds of thousands of people have like gotten this injection. The problem so what it does is it regulates a certain hormone. I won't bore you with the actual hormone, but it allows this injection blocks this hormone from working. So it regulates your appetite, and it just kind of mimics that same hormone. The problem is the list of side effects is like 30 long, and the major stuff is kidney, gallbladder, pancreatitis, diabetic retinopathy. So what they've done, you can, in a sense, you just have to be super cautious. I've seen it. I've heard about this thing. The problem is anytime you start messing with hormones at any level, you're asking for major problems, right? So especially regulation. So one of the things that I always say is, talk to Dr. Rachel at our office, on a great, like some type of weight loss program or something that actually alters the brain state so that those hormones actually become regulated. So, Amy and I have both been on that program, and what's amazing is how you feel once your body is regulated from that. So, I would say try this naturally. Don't do this. Like it's super. It makes me super nervous with the amount of processed stuff we already eat, and then to put more pressure on all those different things, especially the pancreas, the kidney, and the gallbladder. So just a word to the wise. Try it naturally before you do that. Right now, it's a huge trend you'll hear a ton about because it stops you from eating, feeling the hunger. But like our 1% tribe, we're trying to live holistically, and not listening to our body or putting a mask on is not a holistic framework, right? It just doesn't turn out in the best interest because you're not listening to your body, and that's one of the problems. One of my favorite so I'm part of this Harper Creek Optimist Club. They're just a service club, do a lot of things for youth. one time I was at a conference for them and he was the oldest professor so he was an eye doctor, but he was a professor at University of Michigan, and he was about 90 or so. And I just had to go meet him because he was like, he had all the old Optimus stuff, like this whole like Boy Scout uniform of different like badges, and really cool. And we sat down and he actually sent me, I still have it in my office, his research papers. One of the ways that you can do your own diet restriction just in general is stop eating in front of a TV. Because what happens is we talk a lot about it tonight, is parasympathetic and sympathetic, right? So if we are engaged in the food that we're looking, what we're eating in front of us, that's why family dinners are so important, those kind of things. And we're terrible at it. So I'm not saying, that we sit down and do that, but when you're busy, I get it. But in front of that TV, sometimes it's the hardest thing because you don't know, you're not listening to your body. Your nervous system's different, when you're eating those kind of things. So just those are some schools of thought on that one. One that made the news that I thought was cool is one that we've talked about. I'm gonna test Amy right now. You remember talking about berberine?
About what?
Berberine. So we've talked about it, but it was with one of our ones. It's a berberine is the yellow substance that makes like golden seal or your real yellow stuff.
Okay.
We have a lot of it around here, right? So those golden seals are that yellow pigment. What they found is, we know like berberine is like dandelions would be a good example. So it has a lot of berberine in it, right? So tons of benefits, right? Like anti-inflammatory, bacterial, anti-diabetic, anti-cancer, a ton of those things. But one of the things that they just found in just thinking in terms of holistic is it's an antidepressant and anti-anxiety, which is really cool on top of all this other stuff.
Yeah.
Interesting is it's one of the teas that you can go to, or the supplements that it's called berberine rich plants. There is a lot of them. So a lot of your yellow, well, you can kind of think that way. They're finding really good benefits with people that have like a drug withdrawal, right? So like somebody that's chronically on a pain drug that would like to get off of that now. That's why I love this 1% tribe. It keeps me focused too, because I would have not known that would be a really good herb. In fact, I got and some of you, my tea tonight is, so if you're not watching for Battle Creek, Michigan has an awesome store called Horrocks. Horrocks is all kinds of stuff. Their tea section is really good. A lot of loose leaf teas from some farm, I think it's called a Prestige Farm somewhere. But they have, this one is a detox tea with berberine in it, golden seal, all those kind of things. So a lot of times there's quite other things like lemongrass, to make it taste good. But that is a good tea to kind of end your day with, right? Because it'll help all those good things. So that's one. There's two other ones that I found. Deep squats, we should all be able to do them. And one of the things to always do is practice it. It doesn't mean you have to do it as a regular exercise routine, but in your day-to-day life, you should probably think about, at least attempting one. At first, you may need assistance. And what I mean by deep squats, I wish I had, where you go as deep as you can, like your butt almost to your heels. Okay.
You should probably stand up and demonstrate that, Dr. Jeremy.
No, I will not do this. I'll find a good YouTube video. I like that way better. But one of my favorite points of that is in our 1% tribe, we're looking for stuff we can do every single day, right? So every morning before I start work, I do one deep squat to see how my joints are functioning. Also, it's not just about your legs and that kind of thing. It's also about your core. Like how is your core? There's going to be times where you're going to have to get yourself off the ground. And we've talked about that before. One of the best exercises, if you want to start just cold turkey, is lay on your back and get up. Lay on your back and get up. Every morning, just lay on the floor, get back up off the floor, and you've pretty much worked out everything. Deep squats is another level to that. So those easy moves are there. Now, do I highly recommend them as like weightlifting? No, I can't stand them. I'm maybe one of those. A lot of my personal trainers disagree. I don't, because I don't like the range of motion it puts on the knee, like with weight on it. But I just think you're asking for everything, and what we've had our feet talk, where if our feet aren't mechanically right, you're putting a ton of torque on that knee in a non-correct manner, right? So that's why deep squatting and in working out might not be the best move, but doing one to see where you're at is a really good idea. So here's a new one. I don't know how you do it, but peppermint oil for irritable bowel syndrome. So I thought that was kind of cool. That one, you can Google that one for how you take those, or how you take that. Some people, I'm not a big fan of eating the oils as much. With peppermint oil, the edible ones, maybe, like putting them within, a salad or something like that could be a big way to go. So those are the ones I got this week.
Cool.
Yes, I know. It was good. All right. So now let us get started with the wrist. Oh, host. Oh, shoot. Hang on. I might have to steal you back. Let me see if I could reclaim host. Hopefully that doesn't do nothing to you. Okay. All right. Now I can screen share. All right. Here we go. Do that. I think that's the one. Okay. Here we go. So let's start with this. So I really like this guy's presentation. So we're going to do this first. Oh, what happened? Okay. Oh,
in between those tendons. That's what
all right.
they're doing, some revision exams or something. So we looked at the forearm and the hand last time, and sorry, I started talking about extensor carpi. Oh no, I started talking about the extensor carpi radialis muscles, and I flipped and started calling them flexor carpi radialis brevis and flexor carpi radialis muscles. Sorry, thank you, Terence, for pointing that out. I've added a little annotation, so watch out for that. Yeah. So this week we got that far. How about we do that bit? Should we do that bit? Just add the next set of muscles on there. So here's the hand. I got the bones as well, so we should maybe talk about some of the carpal bones. Should we start with the carpal bones? Can do. Right, so let's stick with the right hand, because that model is the right hand as well. So here's the right hand, here's the thumb. Here's the first metacarpal of the thumb, the first metacarpal articulated with trapezium. Trapezium is here. So trapezium then has scaphoid, and scaphoid is between trapezium and the radius. And it's the scaphoid that people break when they fall and break their fall with a flexed wrist and so on. And of course, when we're talking about the anatomical snuff box, if somebody's broken their scaphoid bone, you can often tell that it's broken by poking inside the anatomical snuff box in between those tendons. That's where you find the scaphoid bone. And if they get pain, they may well have broken the scaphoid bone. The other thing I always remember is this little bone here, like a P, so that's pisiform. Also over this side, we've got this hook. This is the hook of the hamate, so the hamate is over here. So this is over by digiti minimi, the little finger. And pisiform is beside triquetrum. So now we've got 3 more bones left. These 2 in the middle, we've got capitate and lunate. So capitate is the big one here. So capitate is articulating with this metacarpal here, and lunate is around here. The trapezium, scaphoid, and then the little bone That's trapezoid. So trapezium at the base of the thumb, scaphoid between the trapezium and the radius bone, and trapezoid is the little bone in there. And then we've got capitate, and lunate, and then the one with the hook, that was the hamate, hook at the hamate. This P here is pisiform, and pisiform is on top of triquetrum. Those are the bones of the wrist. What about the muscles? The muscles. So here are the muscles of the hand. We talked about palmaris longus last week as one of these tendons here.
All right. I just wanted to show you the kind of the breakdown on this. And I like this English accent, so we stuck with it. But the a lot of times you can see how close he had to you see how tight and all those different joints are. So it was a good shot of like what happens in, like, I had a electrician come in last week, and I had never adjusted his wrist before, and he adjusted it, and he's just like, that was amazing. I was like, what is, I mean, a lot of people go, what is that? You know, like each one of those bones, a chiropractor has a specific move for. And so a lot of times it feels like we're just snapping the wrist, but however, we're putting it back where it needs to go. And so you'll see us kind of work at different angles. Why we get a bunch of different pops out of there is because all of those bones that he just did, there's 2 levels of those that have to work perfectly together to make a good wrist motion and a good strong wrist motion. And so I wanted to show you that one, and then we can kind of get a good shot, and then we'll talk about this one. So
this animation.
Oh, come on. Sorry. Read this. Okay.
It's time for me to get set up for therapy, and I use this.
Sorry. I'm not sure how to do all the ad things yet. So.
It also provides
Okay.
and nearby 2.5 fingers.
All right. Let's go back. No, shoot. Sorry. Hang on. All right.
It also provides.
Okay. Let's walk through a little bit of this. One's only 3 minutes long, so it's probably worth watching.
The carpal tunnel is a narrow passage in the wrist. It is formed by wrist bones on the bottom and sides, and a tough band of connective tissue called the transverse carpal ligament on top. Muscle tendons and the median nerve pass through the carpal tunnel. The median nerve controls muscles in the palm and base of the thumb, allowing them to move. It also provides feeling to the thumb and nearby 2.5 fingers. Carpal tunnel syndrome is a condition where tissue swelling causes pressure to build up within the carpal tunnel. This puts pressure on the median nerve. Over time, median nerve pressure results in symptoms in the areas of hand it supplies. Common symptoms in these areas are pain, numbness, tingling, and weakness. Risk factors for carpal tunnel syndrome include a smaller carpal tunnel from being female or from genes passed down from parents. Wrist injuries. Other medical conditions that cause inflammation, fluid buildup, or nerve damage, such as diabetes, pregnancy, rheumatoid arthritis, obesity, and hypothyroidism. And repetitive hand or wrist motions. A common treatment for mild to moderate carpal tunnel syndrome is keeping the wrist in a neutral position by wearing a brace or splint. In addition, non-steroidal anti-inflammatory drugs, or NSAIDs, may help relieve pain. A doctor may also recommend a corticosteroid injection to reduce inflammation and swelling. For moderate to severe symptoms, a doctor may recommend a surgical procedure called carpal tunnel release. This procedure may be done as an open procedure through an incision in the palm and wrist. Or it may be done as an endoscopic procedure through a small keyhole incision. The surgeon will perform this procedure with an endoscope, which is a device containing a tiny camera and surgical instruments. In both procedures, the transverse carpal ligament will be cut to relieve pressure on the median nerve. At the end of either procedure, the incision will be closed with sutures.
Oh, stop. Okay, I'm gonna go back. I hope I can go back. Okay, so in this video, it's kind of hilarious because it's I'm gonna dispel most of it, unfortunately, even though it's an awesome video for the carpal tunnel. So there's a couple of key underlying parts. One is their incorrect assumption on that the tendons swell. Okay, so tendons are dumb. They go where they're told to go. So there's a couple major factors that they don't bring in. One of the reasons I showed you all those different bones of the wrist is because each one of them, you can see how close these little bones are. If you kind of imagine those little Lego blocks here not being in the right position, and look how little space you have for those to be in the wrong position. Does that make sense? So like, if one of the biggest misconceptions, unfortunately, is that carpal tunnel is from swelling of nerves. Well, in our world, like if you're coming with this, we got to find out the why. Why is that happening? Many times the why is actually simpler than most people think. One of the biggest things is, like, as we're looking at the why, as a chiropractor, I'm looking at your neck or your spine first, your shoulder, how your shoulder's reacting, then to your elbow to see how your elbow's reacting, then your wrist. Whichever one is the one that has the motion that doesn't work is where we want to be. One of the problems is that we think it's an immediate wrist problem. It may not be. It might be an elbow problem. It might be a shoulder. A lot of times, probably 60%, 65% of the time, it's your shoulder, because the mechanics of the shoulder lead to bad mechanics at the wrist. Okay. So just to let you know, like, that's the difference in like a holistic time frame. The other one is there are so many other options versus, anti-inflammatory, NSAID, cortisone injection. Actually getting it treated, if there's scar tissue there, the scar tissue can be treated. And that's where Amy knows the gua sha, the laser, there's a lot of alternatives to injecting your big main ligament to your hand, right? So that's the biggest thing that people, have to understand. That ligament, if it was about swollen tendons, wouldn't you do something to the tendons? Instead, you go after and you cut. Let me bring you to there. You're just opening space. This is exactly, so all we're doing is opening a space for inflamed or bad mechanics to happen. Does that make sense? So we never fixed, let's say, the mechanics of the wrist or the elbow or the shoulder. We just open this sucker up, right? And so that's one of the problems, like looking at it, and why a lot of times your carpal tunnel type stuff in the wrist is super ineffective. And so tonight is going to be about strengthening and understanding how important this stuff is, because cortisone, like carpal tunnel, is a very, very common surgery that's out there. Like 1 in 4 people with hand pain will probably go get some type of carpal tunnel treatment. And for the most part, if we understand how it works and continue, and it's an easy one to actually work on your own, right? So So a lot of times we fix the scar tissue, we fix the mechanics. It's much, in my clinical opinion, a lot of times it's way easier than the foot because it doesn't have like what we talk about, that subconscious program can be not as ingrained maybe in your hand necessarily, right? So if we can fix the mechanics of those shoulders, it's a little easier to do than it is like walking, right? So that's where I wanted to bring you to that attention and how important this is for just general purpose, because almost I think everybody uses their hands at some point in their day.
Yeah.
So it's one of those where lots of alternatives to cortisone, aspirin, and surgery. That's really, really what they do, and so does it take a while? Yeah. When you have an injury to, let's say it's the ligament, it's going to take you a while to get that fixed up. What happens if we end up figuring out how to reduce the inflammation, get rid of the carpal or the scar tissue and all those, your tendons start to work better, because you got to remember, and you'll see it in the next video, these are just tendons. They're not muscle bellies. Okay. So these are just tendons. And so what happens is like the muscle, we'll talk about it, but the forearm, this way, the forearm, the muscle belly is here, right? The tendons are running through that in there. It's like how God made this perfect like that is just amazing. But so you have tendons that pull, extend the hand, and the ones that flex it. And so those tendons and those forearm muscles are what we have to focus on, because we got to know why the muscles of the forearm aren't working, if that makes sense. So we'll move on, because I could talk about the wrist all day. Let's do this guy, because we'll go pretty quick through his stuff. We're not going to let him talk too much.
Why are you naked? Because my t-shirt sucks. Look at you.
That's awesome.
Your true classic tee. Dr. Jared, these are the best exercises to strengthen your wrists at home.
Okay.
It's a great way to improve stability.
So I'm going to skip through a little bit until he gets to right here is a good. See how all these are tendons? So the muscles are all through here, but what passes through that wrist is just tendons. Okay. So his forearm, I'll move this out. His forearm, the muscles are here. So if the muscles of his forearm are telling him, from his elbow or shoulder to not work right, then you're going to have the problem at the wrist. Does that make sense? So that's why Amy knows, like, like when you start in any kind of massage situation, you can feel the different trigger point muscle knots. And a lot of times they're not, where so many people have the shoulder stuff that, that mechanics of the shoulders not working, and that leads to those hand situations. So, all right. So I'm going to move to, so some of the tools are pretty cool. He does a couple really good ones, so I'll let him do a couple.
Exercises. Everything I'm going to show you is linked in my description down below if you're interested in picking some up for yourself. The other thing that I want to mention is I'm going to be showing you most of these here in a seated position, but you can also.
He's kind of like your host. He talks a lot.
Is going to be bringing the back of your hand up towards
Yep.
this. The easiest way to do that would be with a dumbbell or with a resistance band. What I'm going to do is you can sit next to a table with the dumbbell in your hand and your wrist bent over the back. That's take the upper arm, the biceps, some of the bigger muscles out of this movement. Some people find it a little more.
I can't hear him talking, Jeremy.
Oh, sorry.
On the top.
No, you really can't. Okay.
What we're going to do is let that weight fall down into our fingers. And then from this position, you're going to pull the weight up into your hand and then keep going until your knuckles or even the top part of your fingers is facing up towards the ceiling. That's how we know we're getting that full range of motion contraction in. hold 1, 2, and then slowly lower it right back down to the starting position. So from the weight is down to my fingertips, I'm gonna curl it up until my knuckles are up at the ceiling, hold 1, 2, and then return back down to the start. To do that with the resistance band, what you're going to do is just step on it down below, give yourself a resistance that you're comfortable with, and then the mechanics are just the exact same. From this position, we're gonna curl up as
Now, while he's doing that, like these type of exercises, because it's a different type of muscle, like think a big postural muscle when you're working your forearm. So a lot of flex and hold, and doing it nice and slow, and you'll really start developing. One that he doesn't have, I was gonna grab it for my barn, that I do all the time, is I take a bar, okay, and I put a string on it, and then I put a weight on the bottom of on the floor, okay, and so I will actually put it above my head because I try to engage my shoulders at the same time, and you're doing the same thing. You're trying to roll the string with the weight up to the very top, okay, and then you can flip it and do it the opposite way. It's phenomenal, and kind of like a sit-up. You want to work it like a sit-up, if that makes sense. Like a lot of extreme go until you can't move anymore, because it's such a small postural muscles type thing. So these are pretty basic. As you go, I'll get you past that. I really like this one. Let's go to that.
grab it down here kind of on one of the ends. I don't want it to be right in the middle because that's just going to be kind of a counterbalance. There's not a lot of resistance there. But if we grab it on one side, all of a sudden that adds a lot more resistance to this motion. To strengthen that radial deviation, what I like to do is put the forearm once again right down on my thigh. I've got the dumbbell gripped down here on one of the ends. I'm going to let this end fall down towards the floor as far as I can take it, and then use my muscles to pull that end back up towards the ceiling. So it looks just like that. And again, about 10 repetitions, 10 to 20 repetitions is a good number to shoot for. I brought my hammer down into my gym today because if you have a hammer, that's also a convenient way to add some resistance to this exercise as well. That weight is pulling it down and you're pulling it back up. That's even a little bit lighter than a dumbbell. So you can keep that in mind. If you have the resistance band, this one's also really easy to get into. The only thing that I'm going to tell you is that I want you to pull that handle through the loop so that it looks kind of like that right there. And so now we want the resistance to come over our index finger. And so what I'm going to do is grab that handle so that it looks just like this, okay? And now the mechanics are similar to what we just got done doing. I'm setting my index finger down towards the ground in this position, and then I'm going to use my muscles to pull that index finger up towards the ceiling and then return right back down to that starting position. You can do that supported on your thigh like that, or another easy way to do it would be to let your arm hang down here to the side, and then all those motions look the same. Now, ulnar deviation, that's actually the only way that you can do this one with the equipment that we have right here. And so now what I want you to do is grab the top of that dumbbell, let your arm hang to the side. You're going to let the weight fall down to the ground. So this part of the weight fall down to the ground. Your thumb is up towards the ceiling. Now what I want you to do is raise that part of the weight up towards the ceiling, thumb down towards the floor, and then slowly return back down to that starting position. So it looks just like this. That would be the ulnar deviation motion. Once again, if you've got that hammer, if you've got that hammer nearby, that's an easy way to do this exercise. What we're going to do is it's that same handle setup, but now what we're going to do is grab it so that it's looped down off of the pinky side, and then we're going to step on it right close to the handle. Looks just like that. And so now what we're going to do is pull that pinky once again up towards the ceiling. So 3 different options on that one. And again, what we're going to do is shoot for about 10 to 20 repetitions, repeated 3 times on each of those exercises. These next 2 exercises are going to control rotation at your wrist, or motions that we refer to as pronation and supination. The easiest way that we can strengthen those is going to be with the dumbbell or with the hammer. So with the dumbbell, we're gonna take that same grip, we're gonna grip right down here or around the end of the dumbbell. With your arm bent to a 90-degree angle, you're going to let that weight fall first to the outside, and then we're going to use those muscles to pull it up and over, and then let it fall to the inside as well. And so when the palm is up, that's called supination. When the palm is down, we call that pronation. We get to work both of them with the dumbbell as we go side to side, just like this. You can also do the same thing, like I said, with a hammer, not quite as much resistance, but if you don't have the dumbbell handy, that sure is an easy option. The only thing that I might mention to you on this one, as you're doing it, don't do it with your elbow extended. Don't do it with your arm out straight, because what a lot of people will do is just rotate at their shoulder, internal and external rotation at their shoulder, with really no motion occurring at the muscles in their forearm. Keep in mind that we want that movement to occur at your forearm. Keep that elbow bent to a 90-degree angle as you're going to drop that weight from side to side. And so again, about 10 to 20 repetitions to each direction, and then repeat that one 3 times. Finally, these last 2 exercises might come as a little bit of a surprise, because many people don't realize that most of the muscles that control your fingers and your grip and your finger extension actually originate right down here in the forearm. And if we can strengthen those muscles, that's a great way to strengthen the wrist and improve stability in that area. This is how I like to do that. And so when we talk about grip, when we talk about finger flexion, there are a lot of ways you can do that. Some of these little grippers, there's different grippers, there's different putties, there's different things that you can buy to improve grip strength. Once again, I've got them linked all down below if you're interested in checking those out. But everybody has a towel. And what you can do is, if you can roll up that towel to a size that fits into your hand, where you can almost wrap your entire hand around it, and then we can use that to improve that grip strength. So what you're going to do is squeeze and hold, count 1, 2, 3, and then try to relax. And then squeeze and hold. You're really trying to grip that. You're basically, if this was a soaking wet towel, I want you to really try to squeeze and wring all the water out of it, and then relax. That's a great exercise. That's a great isometric to work on that grip strength, and again, improve strength at your wrist. 10 to 20 repetitions, repeat it 3 times, or you can also work on improving or increasing the amount of time that you're holding that contraction. That's another great way to progress it. Finally, the one that nobody thinks about, that in my opinion is one of the most effective exercises out there for your hand and wrist and fingers. All that we're going to need is a rubber band. This is going to work on finger extension. I'm going to loop that rubber band right here around my fingers, and then really simply, I'm just going to try to open my hand as wide as possible. So it looks just like that. Hold 1, 2, 3, and then come right back down. Now, if that's too easy, we can always get a smaller rubber band. We can get a thicker rubber band. You can get multiple rubber bands and loop them around there until you find a resistance that you can do about 10 to 20 repetitions comfortably. And then again, about 2 to 3 sets is what we're trying to shoot for on this one. These exercises are designed to help strengthen your wrist. If you have mobility issues, if you need to stretch, if you need to work on the range of motion in your wrist as well, I've got you covered there.
All right. So pretty detailed, isn't it? He did a pretty good job. So I would, I would say, I think for the most part, I think I'll save the other one. Most of them, you understand, fingertip push-ups pretty much. So there's a lot of good. I think he does probably for now. Let me get out of this then. Yeah, I think that's enough. That was quite a few different ones. And I want you to think in terms of like when we start to, one of my favorite things, and if you haven't gone to watch it, subscribe and then listen to my brother Ryan. He knows one of my favorite things in the world is bodybuilding. I loved doing it in high school, college. I feel like with children, I don't know if I could ever get back to that, like just schedules and stuff. But eventually, that's what I'd like to do. One of the things that I love about bodybuilding is because they have a different focus when they're working out. And so a lot of people have, I got to work out for this certain thing. But with bodybuilding, it basically, you could put those different movements in, and you're going to help your body with a few things. One, I do on my shoulder day, that's my day of forearms. So I do forearms on that day. And now, based on the videos I've been watching, I'm going to add some of those other ones that are off of there. You know, having strong forearms are going to lead you to stronger grip strength. Stronger grip strength will then get you to stronger bench press, stronger whatever you'd like, you know, stronger getting out in the garden and actually pulling on the, oh my God, like the vines. I had this one lady, she hurt every joint in her body. She saw this one vine, she was going to pull it out from around her house. And it ended up, she said, she thought it was like 3 feet and it ended up being like 300. And so she's about 120 pounds. So she starts yanking, and that sucker is not coming out, and it just she just keeps coming. And so I always say, like in a grip strength situation, you're gripping and pulling, right?
Mhm.
When you get tired, what happens? You're gonna start pulling with your body. So ends up she
Yeah.
falls and you know at the very end of that 300 feet of vine that is all over the place. That is the biggest thing. So wrists are super important. It's one of my favorite to see results with. I think you know, I have a passion for each joint. I don't, you know, as a chiropractor, you think everybody thinks spine all the time. But, you know, for me, it is for sure all of them, you know, and because I mean, you can from the smallest thing to the largest, you know, and I want to end it tonight with one thing that actually happened to me, like an experiment. So I use a certain technique where there is in my wrist, I have to adjust people with my wrist closed. Over 23 years, that could take a toll on my wrist doing that. Well, what happened was, and this is actually about 3 years ago now. So about 3 years ago, I got what they call the trigger finger. Now, the trigger finger, if we go back to that old the anatomy one, is just that tendon. You have like tendon and scar tissue that builds up over that tendon, and then it has a hard time getting over the little joints of each finger, right? So I was petrified of getting my hand worked on with surgeries because I know how weak, there's so much strength in your ligaments of your hand that to weaken it, I did not want to do that. So I decided, and literally I would get stuck like that. Like it was crazy. So it would be stuck. I'd have to literally pull it and then do that. And now I have nothing. And the reason is because we went in understanding the anatomy of the hand, right? I knew there was a tendon throughout that wrist or for that pinky. I found the tender point and I started going across it, like, because you have the tendons that go this way. Man, I should draw in my own hand. And then you come across it, and I started slowly rubbing that out. So you started rubbing that tendon out, and eventually it got where it wasn't doing that at all. I feel really, really good on the strength part, you know, and just knowing that I have to take care of my wrist a little bit better than that, you know, in the future is a big thing because, you know, I'd really rather have them working at the points. That. So yeah, I think, do you have any questions, Amy?
No, I don't have any questions.
Good. All right. I think we're doing pretty good. All right. I think, Christy, do you have any questions? If you don't, it's okay. Or if you do, I love them.
You want to hear something funny?
What's that?
So when I go to the ladies' room, I started doing squats.
Smart.
Awesome.
Well,
No,
Just-
that's perfect.
throwing something in the daily schedule.
Thank
Mhm.
you. That's what's crazy. Like, if you can think of things to do, right? And then when we get into the mental health stuff, like where Amy, it'll be in there too, that subconscious program, any way you can break it, because it's so hard. Like these are your subconscious day to day is work and the exact patterns at work. Like, why not you change that up a little bit And then all of a sudden you're doing that, right? So now we can say, all right, you go to the bathroom, you do that, right? You walk, you start your computer at the office, and now you're doing your wrist stuff before you do that. Like those are super simple, like, because a lot of times you're not going to have time for all of it before work. By the time I'm done,
Mhm.
guys in 1% tribe, you'll have so much. But I always say, like, I don't want you to do it every day necessarily either. Like, you pick and choose, do those kind of things. So good job. That's awesome. All right. Jess, you got anything? This one would be interesting for you, because that, like yours, you could get some powerful athletes out of this.
Yes, that's what I was thinking, is I need to like go back and watch it and write down some of those exercises.
Yeah.
But
Yeah.
I noticed that for people in my profession, even when you don't utilize those muscles the same way through the summer, like when you're back to school, I'm much more like sore or tend to have some like flare-ups in the wrist area from writing and typing more frequently, but also like gardening, right? Pulling weeds and all of that. So
Yep. And think about it as, so your wrist is a very important, like, there's this thing, I'll bring these up. So there's things called fast twitch muscles and slow twitch muscles. Okay. So a lot of times they actually respond different. So you have different types of muscle. A good example is your thigh. You can have a mix of those, right? So you have things that are important, like I'm trying to think of how I want to describe this. So a dog's jaw. So let's say you have a pit bull, right? And those pit bull, when he grasps, he isn't letting go. That's a mechanism they've learned in their natural life, right? That means that muscle is different than the muscle of his leg that's letting go and relaxing and going. Does that make sense? So when grip is such an important strength characteristic, but it's about the length of the time of the grip can be different. So can you grip for a really long period of time? My favorite, oh my God, it's such a cute, Rex will be really happy. My dad, we would have one test of strength every day. We would grab each other's hands, and he would start. I could not beat the man for years. He crushed me with his little sausage monster arm fingers. It's because he was a farmer. He was a farm kid, and those guys it's like a pipe fitter. When you meet their arms, they have great wrist strength. Now, the problem is they have wrist injuries because usually it's their shoulder that gets messed up, but they feel it because they use that wrist. So, they're so strong, or they're uneven. They're so strong in their wrist, and the rest of their upper torso isn't hanging with the rest of their body. You can have some stuff like that. But my dad, we'd go in these grip strength until one of us collapsed. And on my proudest day of my life was when I finally turned it where I was going to beat him. And then he changed his ring on his hand. So it was just up where when you're squeezing and you got a ring on. Oh, you gotta like squeeze me down. Oh, I thought I had a beat, but that's how it goes. But yeah, those kind of things, do it with your kids. Like, have the test of strength, right? Because you're strengthening them. And like Jess knows, some of these kids that are really good at like a backhand string or, those kind of things, they're kids that get their hands dirty and strong, right? Throwing a ball, right? The kids that are weaker on that situation, like my daughter, Allie, I don't know if I would mess with her in the grip strength thing because of how much torque you got to put on a softball, right? But if you want to help your kid and help you at the same time, that's a great thing. You just grab and squeeze until you can just figure out like who wins that battle. But So hopefully you guys love this one. I could talk. I love the wrist. It's one of those, the feet, knees. The knees go where the feet go. The wrist, the elbow kind of goes where the wrist or the shoulder goes. Super complex. You know, when you get an injury there, it can be hard for an athlete because it's so complex, and the lack of knowledge we have in medical frustrates me. I'll be honest, in the carpal tunnel range, because you can move those joints, and those joints in your wrist are super important. So that's all I got for tonight. We did good.
Yeah.
I was worried tonight. I was worried I would go over, but I don't want to do that to you people, especially in the summer, for sure.
That's right.
Any final questions, anybody? I know this is good. Yeah. So I can't remember what we're doing next week. I got to remind myself to actually do that.
Good idea.
Make sure you guys know. Make sure you know it's coming next week. Growing though, we're starting to see. So if you know somebody that be interested, just let them know about it. We're having a blast. We're starting to get some big views.
Awesome.
I just see this coming every time. You know, like as we go. So, and that is all I got. So, all right. Have a good night to everyone.
You too.
All right.
Bye.